Hello, I'm Bob Chaloner, the Chief Administrative Officer at Stony Brook Southampton Hospital, and I'd like to welcome you to another edition of Focus on Stony Brook Southampton Hospital, your program about the events, the people, and the services at your local community hospital. Today we have a very pertinent topic. We're going to be talking about the measles, something we've heard about quite a bit in the news recently. And I'd like to welcome our Chief of Infectious Diseases, Dr. Rajeev Fernando, who's been with us for a number of years now, right, Dr. Fernando?
It's closing in on 8 years. Never felt like leaving the minute I stepped into this hospital. It's a wonderful place.
Wonderful. We're very lucky to have you here. And welcome to the program, first of all. And I'd like to just, as I do always, just ask you to talk a little bit about yourself and how you made it out here to the East End.
Sure. So basically I did my medical school in India, did my residency in Brooklyn Hospital, and after residency I spent a lot of time working in impoverished countries, which is why I chose the field of infectious diseases, and I joined Doctors Without Borders for a while after that. During that time we organized a lot of mass vaccination campaigns all over the world, and that's what actually made vaccination such a special topic for me. And seeing how we saw numerous kids all over the world suffer from complications by just missing a dose of a vaccine. So vaccination is very close to my heart, and I'm happy to be here today. Subsequently, after that, I did my fellowship at Dartmouth, and then I'm here for the last 8 years now.
Wonderful, thank you. And many people aren't aware of what the various medical specialties are. Your specialty is infectious diseases. And how does that differ from some of the other specialties?
Yeah, infectious diseases is, for me, I feel the coolest specialty there is. Right. We deal with every specialty, so you can have a brain infection, a heart infection, an orthopedic infection, gastrointestinal infection, and then of course general medicine as well. So it's a great field where we interact with all the specialties, and we do our best as a multidisciplinary approach to get the patient better. So it's a great field. Unlike cardiac, or let's say someone has a heart attack, when they get a heart attack, they have dead tissue, dead cardiac tissue, and they will have that dead tissue forever. Right. But with the field of infectious disease, if you have a right index of suspicion, you treat the patient with the right antibiotics. Sometimes they just walk out of the ICU and know the problems for the rest of their lives. So it's a very gratifying field.
I've heard it described, it really is being like a detective. I mean,
that's exactly. A lot of people ask me, when you watched House, was that the inspiration for you joining infectious disease? Inaccurate, but yeah, it is a lot of times an infectious disease, like a detective kind of approach.
Interesting specialty too, because I think for the last few decades anyway, we thought we kind of won the war against infectious diseases, and many of the things that were not in were really making people sick and killing large numbers of people for a long time. It seemed like we had won the battle, and it almost seems like there's been a little bit of a reversal of that in the last few years for a lot of reasons, I know.
Yeah, unfortunately you're right. They said there will not be any infectious diseases by the turn of the century, by 2000, and they predicted there won't be any more. We've used antibiotics very haphazardly, which has led to a lot of resistance. Bacteria have been around for billions of years, and they are currently outsmarting us. So that's one of the issues. But we are doing a lot of research right now. Currently, there's genetic engineering on using viruses to treat these resistant bacteria. And another field I feel, which is why I'm here today, is if we're going back on vaccinations, if we don't act very quickly, we could be facing a global threat. So I'm very happy to be discussing the topic today.
Great. So thank you again for being here. So we're going to focus on one of the infectious diseases we've heard quite a bit about, and I think it's caught a lot of us by surprise. I mean, when I was a kid, X number of years ago, people actually got measles. I had measles as a kid.
Right.
And then we seemed like we had won the war against measles, and it went away, and we're hearing about it again. Suddenly there's this outbreak. And just to begin with, let's start with the basics. What is measles?
So measles, for me, is one of the most infectious viruses I've ever encountered.
Right.
It's a virus, like you said. It was universal. All kids would get measles. Back prior to 1963, when the vaccine actually came out, every kid would get measles.
Right.
So after 1963, we developed this vaccine, or my colleagues from the past, And we've had great success rates with the measles, upwards of 98% success rates with the measles. For people who don't know about the measles right now, I understand the community because people only in that era, they saw how bad the measles were, how sick people would get, how many hospitalizations there would be as a consequence of not getting a measles vaccine. It's changed now because we just don't see clinical illness because of the measles, because it's become, we take it for granted. Everyone gets the vaccines. We're not getting, we're not seeing the clinical disease. So a lot of people just don't understand how sick people can get. Like I said, it's one of the most infectious viruses there is out there. Just to put this in perspective, let's say somebody who has an active Ebola virus currently, they expect to affect 1 to 2 people.
Okay.
But let's say someone is actively infectious with measles, you can infect up to 12 to 18 people with the measles virus.
Once you've got the measles, right?
Yeah, and as a matter of fact, even if you were standing right here and you have the measles virus, and even if you go away, the air that you're breathing above can be infectious to up to 2 hours after that.
Really?
So it's a very contagious pathogen.
I was going to ask you, how are the measles spread?
Yeah, it's spread through what we call droplets. So droplets are usually when someone coughs. It stays in the air it can stay as long as 2 hours, and usually within 6 feet. So if you're within 6 feet, you're predisposed to getting this infection. Usually, what makes it a tricky virus is we have something called the incubation period, which means the onset of actually getting the virus to actually clinically manifesting the disease. It can range anywhere from 6 to 21 days. In my clinical experience, on the average median, it's about 10 to 12 days. It starts with what we call an enanthem, which is a rash which is within the body. So that's an enanthem. You have manifestations in the mouth. Following that, you have an exanthem, which is an outward rash, starts in the face, goes all the way down, and that's when that's when you suspect that you have the measles. The problem is you're actually infectious before the rash develops. So that's a problem. I urge parents, everyone, especially people in the area who've had cases of measles, to be very vigilant. So if you have fevers, just not feeling right, some body pain, a running nose, a conjunctivitis, to be really cautious, because that's the problem. By the time you actually see the rash, it's too late. You're infectious.
Is that why when we've heard of cases with measles, suddenly there's this effort to get the word out in a large population because of all the people exposed?
Absolutely, yeah. So it really started for me, it started in 2014 with the Disneyland outbreak.
Okay.
It was about 131 cases. And think about it for a second. You have 40,000 people come to Disneyland every day. And to track down patient 0 and to see the other risks, it's very challenging. So we, in the past few years, we used to see outbreaks all over the country, but they're limited to certain areas. But what concerns me right now is we have 25 states and they're all existing at the same time, which makes me very worried and concerned that we're having more and more measles outbreaks happening at the same time, as opposed to 2014, when it was just in Disneyland.
Just
so this is
little pockets, right?
Yeah, that's correct. Yeah.
Are there some places in the world that's they're more endemic than it is here?
Yeah, to be perfectly honest with you, so in the States we've recorded about 800 cases this year. Europe actually has a whopping 83,000 cases this year alone. Yeah, places like Romania, Albania, and Ukraine serves as a big problem. There are about 24,000 cases over there as well. So this is a global problem, and we really need to get our act together with this.
Just to put it in perspective, the 800 cases we're seeing this year, there's a lot of talk about that. What was it up until recently? Was the number much smaller?
Much smaller, and we've been progressively seeing increasing cases over the past few years. But this year we've seen much more, mostly in the New York region, a couple of areas in Brooklyn, Rockland County. We're seeing more and more cases over there. That area tends to have a population with possibly religious beliefs where they're not vaccinating their kids. And that's actually one of the reasons why we've seen more than 50-60% of our cases in the United States this year are from that area.
Right. And I know that you had described a little bit some of the symptoms, but what are the things to look out for?
Sure. These are the basic symptoms. Basically, you'll have a fever, body pain. Sometimes these fevers are as high as 104. Body pain, a rash, like I mentioned, a cough. You have something what's called the Koplik spots, which are little pearly spots in the back of your mouth, which your physician will be able to help you out with. And then after that, you develop the rash. Usually ranges about 4 to 5 days is the clinical illness. Now, About 1 in 10 people are not so fortunate. They get ear infections. About 1 in 20 actually get a pneumonic process. So they get a pneumonia with what's called a superimposed bacterial infection. So when a virus actually compromises your immunity, bacteria see this as an opportunity and then cause a pneumonic process as well. Very low mortality rate, but people get very sick, and about 1 in 4 of these affected patients get admitted to the hospital.
Are there age ranges where people are more susceptible?
Great question. For me, the children, and when you're young, your immune systems are not really formed well enough. So children, you tend to get more severe infections. Another thing for me is I think pregnancy, I feel, is also considered immune compromise. When you're pregnant, your physiology is affected, and that actually renders your body more susceptible to getting these kind of infections. So the two groups of people I feel which are higher risk would be immune compromised patients, children, younger children. I feel the younger the child, the more the chance of getting infection, and pregnant women as well.
So what are some of the risks for some of those populations? I mean, you said in most cases the disease lasts 4 to 5 days or so, and then resolves itself. Why should we be worried, though? I mean, if that's the case, what are the risks?
That's a great question. This is such an infectious virus, and if we do have complications from this. Like I mentioned, 20%. Can get pneumonias, 10% get ear infections. Right. And these pneumonias, they start off as a pneumonia, they often get complications, abscess formation. The same thing can happen in the ear. So we're putting ourselves at risk for these kind of complications. A lot of times when you get the ear infections, as it progresses, the severity of diseases progresses, you can actually get deafness.
Really?
So these are important things. Pneumonias can progress, they can get abscesses. It's very important to address that. I can't stress the urgency of getting vaccinated.
And as I think about it, as a kid, I do remember hearing about, childhood deafness or kids being rendered deaf from measles back in the day when everybody seemed to get it. And I guess
absolutely. And that's why I think it's important for physicians to bring back those thoughts, or people in today's day and age, in 2019, to really bring back and tell people what measles is all about. Right. The complications, like you mentioned, 1957. I mean, everyone had a measles vaccine. So if you're at that stage, everyone had it. So people weren't getting vaccines because it was universal. Everybody got measles. So it's something that in that period of time, people knew about the importance of measles, but since we just don't see it anymore, no one really knows how the complications of measles is.
Are doctors having a harder time diagnosing it because they don't see it as much as they used to?
I think, no, all our physicians are doing a great job. I think there's so much information and the physicians are completely on top of this. Right. I think they're doing a wonderful job. The rash is pretty pathognomonic. Like I mentioned, it starts at the face, goes all the way down. As a matter of fact, I advise physicians, anytime someone goes to the emergency room, and I've advocated for our emergency room as well, if someone is walking in with a rash, to inform the staff right away, because you have to remember, you're infectious at this point. Right. So anyone with a rash, with certain risk factors, we inform them and they're put right away in a special room. Okay. So physicians are on top of this. The concern I mentioned before is some people, you're infectious before the rash declares itself on the outside. So that's that little window period that we have to be really cautious about.
What should you do if you suspect you've either been exposed or you have some of those symptoms?
Yeah, the first thing I would do is come straight to the hospital.
Okay.
There are two approaches. One is something called an immune globulin, which is something that you give if someone's had active exposure, to give this immune globulin, which will prevent or protect. In my clinical experience, I think giving the measles vaccine within 72 hours is just as good. Much cheaper, works just as well. Okay. So if you have a concern where you feel you've got an infection or people around you, come straight to the hospital. They'll give you a vaccine and move forward.
How widely available is the vaccine? I know that there's been some issues with other vaccines. I know.
Yeah, absolutely. You're totally on top of this. Right. There are a lot of vaccines that there are shortages of. Measles isn't one of them. The shingles vaccine there is, but measles is widely available and can be. You can get it anywhere in our offices or the ER as well.
Okay. And is it the rash itself? I'm fascinated. The picture you see in the cartoons and things are the little red dots everywhere. Can you just describe what it looks like?
Yeah, it's what we call the sandpaper rash. Right. And I'm glad you brought this up because it's often brought about, and they say the physician who knows rashes knows medicine. Right. So it's a really great tool to see what is going on inside the body, and it's an external manifestation. So rashes are very useful. And so if you can see these rashes and describe them, you're pretty much in the zone to actually diagnosing the case. A great question you pose. Okay. And these are actually what we call the sandpaper rash. So if our public, our people, our community watching this episode, they can actually Google measles and sandpaper rash or whatever search engine you use, and it'll come up. It's a very pathognomonic rash.
Okay. Why is it called sandpaper? Because it looks like you've been rubbed with
that's what it is. Yeah.
So not the classic little red dots that you see in the cartoons?
No, not actually. The sandpaper rash is pretty pathognomonic. You know you're in the zone. You can hit your diagnosis right there.
Okay. Are there other common sort of misconceptions about the disease also?
Yeah, it's a very unfortunate. It's a very unfortunate that this does exist. By 2000, we were in a situation to say we've eliminated measles completely. It's a great time. Right. We've done very well. Physicians had worked very hard to do this. Unfortunately, there was a paper in 2009 by a British gastroenterologist. Don't ask me the correlation, but this gastroenterologist had used a research paper which had a very small number of patients which linked the measles vaccine to autism. Okay. And that was published in a very popular journal, and people read this and things changed. Right. Now, we did more investigation. A lot of ID physicians like myself were very upset with this trial. It was such a low patient population. And subsequently, this gastroenterologist who was working on infectious disease vaccines, I don't know why, he confessed and he said the data from his research were fake. Right. And the journal subsequently retracted the article that he published, but the damage had been done at this point. People already, parents all over the world who didn't like these vaccines just seized that opportunity, and people say, this is what this is, and we're calling it off. Ever since then, the Dutch have done a great study which involved 650,000 kids, far out surpassing the 15 patients that this gastroenterologist had, and it's proved safety of the vaccine. Now, the other thing which commonly happens, people ask these questions, is after getting the vaccine, people sometimes get fevers and chills and just not feeling great after it. And actually for me, that's actually a good sign. It tells me the immune system is working very well. So the vaccine that you give you give the measles and then the vaccine, and the immune system starts to fight this, and that creates an inflammatory response, and that's actually a good sign for me. Right. Obviously, the first day when it happens, you have to continue to watch clinically, but parents ask me very often, what is this fever that I'm getting? And I say, chances are it's a good thing. We need to watch you closely, but chances are it's a good thing. Some
of the tenderness and soreness at the site of the vaccine, is that the same thing also?
That's correct, yeah. Right. You also have to watch out for intramuscular abscess, things of that. Okay. I think you have to view it in two different ways. One is the first approach that I mentioned, but you obviously have to look at other conditions, like is there an infection there? Was it given the right way? There are different approaches. But if someone were to call me on the phone and said, Dr. Fernando, this is what happened, I said, let's watch you again tomorrow. Let's reassess tomorrow. But it's fair for me to think that this is a good thing, but let's reevaluate you in the morning.
Before the show, we were talking a little bit, and I think that's important what you said, that the vaccines, when the criticisms off, every year we're urged to get our flu vaccine, and one of the criticisms of the flu vaccine is it's not that effective in some years, that people still get sick after they get the flu vaccine. Can you talk about that a little bit, and also the measles vaccine and
Absolutely.
how effective?
So I'll try to contrast both.
Right.
So the influenza vaccine we have every year, the last few years, it's been in the mid-30s, the susceptibility, the success, the efficacy rates of them. The influenza virus is a very tricky virus, and what all of us in infectious disease, what we're looking for is what we call the universal vaccine. So the universal vaccine is what we're all talking about now, and how do we get this universal vaccine? Right. You might have heard outside they say this is H1N1 or H3N2 or H7N7.
Right.
So they're different. Sometimes when we prepare the vaccine, we can't predict all the mutations that are going to happen throughout the year. So sometimes you have just a little bit of a mutation, and that just changes the whole situation. The vaccine won't cover you. Okay. But what's in evolution right now with research and infectious disease doctors on board as well is the universal vaccine. So it will cover all the H's, it'll cover all the N's, and we're in good shape with that. So that's the cutting edge research and what we're working on right now. And that, like I mentioned before, is the mid-30s. It dips out a little higher and lower. For the most part, it's in the 30s. For me, the measles vaccine is a very easy sell. The success rates are upwards of 98%.
Okay.
And like I mentioned before, if there were, it's really vaccination saves lives. It's pretty simple. They come to talk to me and say, Dr. Fernando, what do you have to say about vaccines? It's very simple.
Right.
It's the simplest answer for me.
Right.
It saves so many millions and millions of lives, which we don't even realize. Because we take it for granted. Vaccination campaigns all over the world, and they save lives. It's pretty straightforward.
If, the flu, we need to be, and what you're saying, kind of explains it, I think. Every year we get the flu shot. We don't just get it once in our life. We have to keep getting it because there's so many evolving strains of the flu.
That's correct. Yes.
Not the case with the measles?
Absolutely not. Absolutely not. The vaccine we have, like I mentioned, 98% or even more success rate. So the vaccine is fantastic. Now, the questions I've been getting recently about is, do I get another measles vaccine?
Right. That was, I had as a kid a vaccine. Should I get it again?
Yeah, it's a great question you pose. And over the years, we've seen cases where vaccination immunity is fading. Okay. And these are things we don't check routinely. But sometimes, just like yourself, if someone comes to me and says, Dr. Fernando, should I get a measles vaccine? The obvious thing to do would say, well, let's check your titers and let's just see where you are. Do you have protective titers or not?
I was going to ask, can you check to see if somebody's actually immune?
Absolutely, right. You could do that. Right. So you can check their vaccination titers to make sure you have enough levels of antibody to prevent you getting the measles again. Okay. I can't tell you the number of cases where up until last week, I'll tell you the current thing which just came out a few days ago, where people didn't have any immunity. And the bottom line over here is immunity wanes. So this is a new phenomenon that we're reading about and following patients with, where we used to think, a one-time dose of this and you're good to go, but we're seeing over the last few years, let's say things like pertussis, right. Whooping cough. I mean, these are things that we have our standard vaccination protocol by the American College of Vaccinations, Immunizations, but now we're starting to see more and more of these infections propping up, and it's really vaccination that wanes. So I do suggest if someone goes to the hospital now or to your provider and say, what are your thoughts about another vaccine? The newer recommendations over the last 7 days actually say, if you want the vaccine, go for it. Go for it, right. You don't even have to check titers, go for the vaccine. There are a couple of conditions where patients who are on chemotherapy have other conditions where you're immune compromised. I think that's important to talk to your doctor. But if you don't have certain criteria, which your physician will discuss with you before you get the vaccine, if you don't have those comorbid conditions, you can get the vaccine.
And it sounded like you said, and I just want to ask the question again, but you can get the vaccine. Is there a cutoff date, or if you've been exposed, should you think you should just go get vaccinated?
I think if you've been exposed, I would definitely get vaccinated. Right. There's some data out there which says the earlier you get it, like within 72 hours, the better. Right. But it's not an unreasonable thing just now. If a patient comes to me and says, Dr. Fernando, what are your thoughts about getting the vaccine? It's definitely not an unreasonable thing to just go get revaccinated.
Another what I think is a little bit of a misconception, but we refer to these things as childhood diseases because we used to get them as kids, but adults are just as liable to or likely to get measles as children.
Absolutely.
Is there a danger of adults getting it also?
Yeah, definitely.
Right.
It depends on your clinical status.
Right.
Now in the United States, we have what's called herd immunity. So herd immunity refers to the whole community getting the vaccines. Right. And in order for someone to say there's herd immunity in this community, you have to have vaccination rates of 95%. So if 95% of your community has been vaccinated, you're in pretty good shape. Now there's certain states, California a few years ago, it went down to 93. So that's when the panic really starts. Now a lot of people coming from foreign countries, they don't have, a lot of times these unfortunate people, they don't carry the vaccination cards and they're not sure which of the vaccines they've gotten. So these are people, when they come here and they're exposed in the right clinical setting, they're definitely prone to getting the measles as well. So yes, we do see textbook definitions. When you say measles, when you're going to look into any sort of engine search, you're going to see a child, but certainly it's possible in adults as well.
Okay, so never too old to get vaccinated.
Oh no, right? Never too old to get vaccinated.
And what are some of the other measures besides vaccination? What are some of the other things we can do just to prevent getting
great question.
measles?
I think basic hand hygiene is critical. Hygiene, hand hygiene. And the other thing I mentioned is there are going to be some patients out there who, let's say, they are going through chemotherapy.
Right.
They're contraindicated to getting the vaccine, and that's something which comes up every day when I get questions on this every day.
Right.
The best thing you could do for that individual who already has a compromised immune system is for the people around to get the measles vaccine.
Okay.
So the household people and the classmates, the school, it's very important to protect this person because if of contraindications where he can't get the vaccine, the family around, the immediate family, school, teachers, they should get the vaccine.
Should pregnant women get the vaccine?
Great question. This is what's called a live vaccine. When I say live, it's not the absolute live where you're just giving a live virus. We give this live vaccine, but we've taken away the strength of the vaccine, of the live virus. So it's what we call when not the actual live vaccine itself. We have the virus, which we weakened its strength. So it's weakened, it's still alive, but it's weakened and it doesn't cause disease. My recommendation over there is to give the vaccine 3 weeks after pregnancy.
After pregnancy.
After delivery,
okay.
yeah.
Okay, great. And last question, and I really do appreciate all this great information you've provided us, but diagnostic capabilities locally, and do we have the resources to get people diagnosed and also get them vaccinated?
Yeah, great question. I think one of the barriers to this, which I think people don't talk about, is one of the problems is really barriers to healthcare. There are a lot of people out there who really want to get the vaccine. There's great social media out there, everyone knows, but it's very unfortunate, even in the United States at this day and age, that people don't have access to the vaccine. That's a really big problem. So I hope legislation, things like that, improve those kind of circumstances. There are a lot of people who just cannot get the vaccine. But in regards to your question, I think getting the vaccine can be at any time. You can give the vaccine at any time. And with regards to diagnostics, like we mentioned before, you can do a serology test. Okay. Traditionally, in my experience, after getting the rash...
Serology means for lay people?
My bad.
That's okay.
My bad. Serology is a blood test which shows the amount of antibody you have in your system and the body's ability to fight off measles when you get it.
Okay.
So there are a couple of approaches. You can actually check. You can check your measles titers, what we call the antibody level. But like for me, like I said, in today's day and age, actually these are updated guidelines from CDC and IDSA just very recently, I think over the last 7 days, where if someone requests the vaccine, just go ahead and give it to them. There's no harm done by this. It'll actually help you even more.
And actually, I thought of one last question,
Please.
which is, you mentioned the rates of infection in parts of Europe. If you're traveling, is it something to be concerned about? And
That's a brilliant question. I'm not sure if the CDC has updated their travel guidelines. It's a brilliant question you've asked. Certain of these countries, they have these rising outbreaks, and I think even if it isn't on the CDC website yet, I think that's a great question you pose, and I think it's reasonable to make sure you've got your vaccine and your titers before you go.
Let your doctor know your travel plans.
Absolutely,
probably, right?
absolutely,
Exactly.
yeah. Even if you're, stopping off, travel is such a fascinating field.
Right.
So a lot of times, like, are you in transit? Are you getting out of the airport?
Right.
How long are you staying? What type of hotel you're staying? There's so much with travel medicine.
Who's in the plane with you, I guess.
Exactly.
Yeah,
There's so many things. So I think the most important thing as a patient when you're going to these countries to not just tell your physician where you're going, but the nature of your trip, where you're staying, how many hours, transit, getting out of the airport are very important information as well.
Well, we're out of time, but thank you very much, Dr. Fernando, for your great information, all the great work you do here at the hospital and in our community, helping us stay safe from infectious diseases.
It's very kind of you for having me, and I will continue to do the same in the future. Thank you.
My pleasure. Thank you. And thank you for watching today. Thank you, as always, to our friends at CTV for producing and airing the program in our Southampton community, our friends at LTV for airing it in our East Hampton communities. If you have any additional questions or would like more information about the measles or any other infectious diseases and would like to contact Dr. Fernando, please feel free to call my number at 631-726-8555 and we will get you in contact with him. We thank you very, very much for watching. We look forward to hearing from you about additional programs or if you need help navigating the healthcare system here in the East End. Thank you, everyone, and good health.